Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then treatment of chronic stable angina. So in chronic stable angina, first line treatment are beta blockers are given to the patient. Like we can beta blockers are actually the first line therapy, and these beta blockers will actually decrease the myocardial contractility, and they will also decrease the heart rate of the patient by blocking the beta receptors. Then we also have non dihydropyridine calcium channel blockers are used like diltiazem. These non dihydropyridine calcium channel blockers like diltiazem, these will cause coronary artery vasodilatation. Okay, and thus these are actually useful in variant angina, and they are also useful in microvascular angina. Then nitrates can be used in chronic stable angina. These nitrates are long acting nitrates are mainly added for these persistent angina or chronic stable angina. And what does this nitrates do? These will cause dilatation of the veins, which are capacitance vessels, and thus they will decrease the preload, and thus they will decrease the workload on the heart. Then we can also give the patient ranolazine. This ranolazine is actually an alternative therapy which is available for the refractory angina, and this ranolazine will actually decrease the myocardial calcium influx. It decreases the myocardial calcium influx, thus it decreases the heart beating, so force of contraction is decreased.
thank you and thank you for watching.